As we age, maintaining our health becomes increasingly important. For those aged 60 and above, regular health checkups can be a vital part of staying healthy and preventing potential health issues. But the question remains, how often should one undergo a full health checkup? Understanding the importance of regular checkups. Health checkups are essential for identifying potential health issues before they become serious. These assessments typically include a review of medical history, physical examinations, laboratory tests, and screenings tailored to age and risk factors. For seniors, this can help in the early detection of conditions such as diabetes, hypertension, heart disease, and certain cancers. Frequency of checkups for individuals aged 60 and above. Annual health checkups are generally recommended. This yearly schedule allows for a comprehensive evaluation of your health status and gives healthcare providers the opportunity to monitor any pre-existing conditions. Regular assessments can also help in adjusting medications or treatment plans as needed. However, the frequency may vary based on individual health needs. Here are some factors that might influence how often you should schedule a checkup. Existing medical conditions. If you have chronic conditions such as diabetes, arthritis, or heart disease, you may need to see your healthcare provider more frequently, potentially every 3 to 6 months. This allows for closer monitoring and management of your health conditions. Risk factors. If you have risk factors for certain diseases, such as a family history of cancer or heart disease, your doctor may suggest more frequent screenings. For instance, if you are at risk for osteoporosis, bone density tests may be recommended every 1 to 2 years. Vaccinations. Staying up to date with vaccinations is crucial for seniors. Your healthcare provider will monitor your immunization status during checkups and may recommend annual flu shots and other vaccines. Lifestyle changes. If you make significant changes to your lifestyle, such as starting a new exercise program, changing your diet, or quitting smoking, it's wise to discuss these changes with your doctor. They may want to schedule follow-up appointments to monitor your progress. Key components of a full health checkup. During a full health checkup, several key components are typically assessed. Physical examination. A thorough physical examination helps identify any immediate health concerns. Blood tests. Common tests include cholesterol levels, blood sugar levels, and kidney function tests. Screenings. Depending on your age and health history, screenings for conditions like cancer, e.g., mammograms for women, colonoscopies for both men and women, may be conducted. Mental health assessment. Mental health is equally important in older adults. Screening for depression and cognitive function should be part of your regular checkups. Medication review. If you are taking multiple medications, a review can help prevent potential drug interactions and ensure that your medications are still appropriate for your condition. Conclusion. In conclusion, for individuals aged 60 and above, annual health checkups are recommended as a standard practice. However, personal health conditions and risk factors may necessitate more frequent visits. Staying proactive about your health by scheduling regular checkups can significantly contribute to a better quality of life and longevity. Always consult with your healthcare provider to tailor a checkup schedule that suits your individual health needs. Remember, taking charge of your health is an essential step towards a healthier, happier life in your golden years.